I became very unhealthy, particularly in my first year here. I gained so much weight, so much weight. And everybody thought they were doing me a favor by feeding me.
In 2007, the Duke Endowment launched an initiative with Duke Divinity School to improve the health and well-being of the 1,600 United Methodist elders and local pastors serving churches in North Carolina.
The Clergy Health Initiative is a 7-year, $12 million investment by the Duke Endowment that partners the Western North Carolina Conference, the North Carolina Conference, the Divinity School, and the Endowment in a program to help foster a culture of health among clergy. And we see it as an issue that strengthens churches, but it's strengthening the life of the church by helping pastors take care of themselves so that they can take care of their congregations.
Y'all ready to work it out? Yeah. All right, we're gonna burn some calories, okay?
If I'm not taking care of myself, you know, and I'm gaining weight, and all of a sudden, I've got respiratory problems, I've got hypertension problems, I got diabetic problems. It will lessen my impact on how I take care of the people that come to this place of worship, and individually, because if I'm going to be sick, you know, quite a bit, and I'm going to suffer a lot of health problems, how am I going to take care of my congregation? How am I going to tell them that they ought to be healthy and fit? Ready?
Amid growing concerns about declining pastoral health and increasing medical costs, the Duke Clergy Health Initiative began with extensive research and planning. In 2008, the research team conducted focus groups and fielded a survey that 95% of United Methodist clergy across North Carolina completed. The findings established a clear picture of pastoral health and the factors affecting it.
Clergy health, I think, has probably, for many years, gone unnoticed. Methodist churches, as we well know, are great for potluck dinners and ministers being at the church night after night after night, making those hospital visits that were virtually unhealthy people.
Pastoral self-care is challenging because the ministry is such a unique calling. And often people who are drawn to that calling have a deep sense that their mission is to serve other people first and themselves second. The problem is the demands keep coming and the times to take care of yourself keep moving further and further into the background.
The Clergy Health Initiative began with a 12-month pilot with 81 pastors. The team then launched Spirited Life, a wellness program and behavioral health study. Developed with lessons learned from the pilot, Spirited Life introduces clergy to tools for managing stress, living a healthy life, and finding spiritual renewal.
When I went for my Spirited Life physical, that was the real eye-opener for me. To go in, to do the weight check, to do the blood pressure check, the cholesterol check, and to realize that my numbers were bordering on a heart attack or a stroke. What was I to do with that? So within 24 hours, I was in the doctor's office. I was being prescribed blood pressure medicine and cholesterol medicine. I was told I had to lose basically 75 pounds. I wanted to live.
Praise the Lord, praise the Lord.
Initial findings from the Clergy Health Initiative have grabbed national attention. We now know with certainty that United Methodist clergy in North Carolina are more likely to suffer from obesity, chronic disease, and depression than other comparable state residents. One pastor in the study group hadn't taken a vacation in 18 years.
One result of the broad media coverage that our project has enjoyed is the focusing of a spotlight on something that the broader public didn't seem to understand before, which is how stressful clergy life really is, and how much more layered it is than the assumption that this is just a person who gets up on Sunday morning and leads worship and may spend a little time Saturday night preparing the sermon that they deliver on Sunday morning. The notion that pastors are as busy as they are and the diversity of the demands on their time are as complex as they are, was news to a lot of people.
And so spiritually, I have to be ready. Mentally, I have to be ready. Physically, I have to be ready. And the times that when we think that we got our own time to ourselves, oops, here's the phone ringing. And you never know what's on the other end of the call.
If I could put my finger on how the Clergy Health Initiative has helped ministers all across the state of North Carolina, probably the one thing that I would say is that it's helped ministers to recognize that they are people too.
So some of the stories that we hear are stories that where clergy are saying, thank you for giving us the space to work on what it is that we need to work on.
As the Clergy Health Initiative is refined and tested, leaders hope to create a model for other denominations to use. A broader goal is that clergy who are inspired to take better care of themselves will preach the importance of that to their congregations and help develop programs at their churches.
They look and see this person slimming down, they look and see this person walking, and they look and see this person that's growing spiritually, but again, they're going, I want that for myself. And that's awesome. I mean, what more could a pastor want than to see his or her congregation wanting a better life for themselves?
I want to be the pastor that they say, you know, health is a good thing. I think that the church will follow the leader.
Our overall goal is human flourishing. And that's the part that seems to really touch pastors when they understand about our program. So we don't want to fix you, and we don't want to decide what it is that you need to do for your health. We want to enroll you in preserving your own capacity to flourish, rediscovering the joy of your ministry, figuring out how much easier it is to live when you feel well.
I'm down, I've lost 30-some pounds thus far, about 32, I guess, and I feel so much better. And at the same time, I know that this physical transformation that's happened to me was more than just finding out my numbers were out of whack and that I needed to lose weight. It's been a spiritual transformation for me, more than anything. And when you become more spiritually healthy, I think you begin to see evidence of that in all other areas of your life.
Congratulations on your victory, Liza.
I truly give God thanks for giving me the wherewithal to say yes to this initiative, because I don't want to think about where I'd be if it wasn't for this.